Alright, today we will be assessing the lungs and thorax. So like everything, it's always good to go perform hand hygiene, and then we go meet our patient, introduce ourselves, make sure this is the right patient. Is your name Mr. Pingy?
Yes, it is.
Check your wristband, spell that. Good, okay. Have them sit up and remove things that may interfere with the examination, or ask them to, of course. And now we can begin our examination after we tell them exactly what we're going to do. We're going to be checking your lungs and thorax. We're going to have to do some basic movements just so I can make sure everything's good. And then we will begin. The simplest part of the assessment is an inspection. First I want to check their thorax, their chest, make sure everything looks like it's symmetrical, even, look at their breathing. Make sure it looks good. Listen for sounds of wheezing or coughing or other such things. Go look at their posterior. Make sure that same thing, everything's symmetrical, everything's even. Go over here and okay, I need to check to see if you're breathing normally. Can you just keep breathing normally? And put your hands on the chest area. And as they breathe out, it should force your thumbs apart, and they should push out both at the same distance on each side. That indicates healthy breathing. You can do the same up near the trachea, and you'll check the same assessment on the back as well. You will also check to see if their transverse diameter and AP diameter are matching well. The AP diameter should be about half the length of the transverse diameter. The transverse diameter is the distance between the back and the AP on the side. There are exceptions to this. The elderly, this will oftentimes be wider than normal. All right, and we assess our patient. And once we've done the basic inspection, then we will begin the palpation. We'll check their respiration, make sure everything's moving properly. And palpation is, in many ways, just a continuation of what we were doing before. Make sure they're breathing properly, feel for signs of abnormalities, make sure the breathing is symmetrical. And then we can go to percussions. To do percussions, we will select certain spots on their body, on the backs, sides, and the chest, that we will tap to listen for a sound of resonance. We begin on the back, find the correct spots, and listen for sounds, resonance. Do the same on sides, alternating between the side. As you work your way down. And you tell them, all right, excuse me, I need to come check the front, check your chest as well. And when you do this, you will listen for abnormalities. You should hear over the lungs a kind of hollow sound. Now when you get down to the ribs, it should be more firm. You shouldn't hear that as much. And once you check that and check for abnormalities, you're going to go back to the back. And there'll be a spot down in the back where you can clearly hear the sound change and dull very dramatically over a short spot. You want to go down on one side and find that. Still hear it, still hear it, still hear it. Don't hear it anymore, all right? And you mark that spot either with tape or a pencil and where you don't hear it anymore. And you go back up and find where you hear that full resonance again. And then you have a spot there marked in two places. You check the other side too. All right, can't hear it anymore there. And you go up and keep checking for resonance to hear the sound change there. And once you have your spots, you'll take a tape measure measuring device of any kind, and you will assess them, and they should be between 3 and 6 centimeters apart from each other, although on Mr. Pinky that will be a significantly smaller portion. The right side should be higher than the left side, indicating the difference in the lung capacity, and that is basic percussion. Then you will go into auscultation. You want to actually listen to the lungs directly. So, Mr. Pinky, I'm going to need you to breathe in and out and say red bird, blue bird, gently over and over again. Red bird, blue bird.
Red bird.
So I can hear your breathing correctly.
Red bird,
Mm-hmm.
blue bird. Red bird, blue bird.
I will assess
blue bird.
breathing.
Red bird, blue bird. Red bird, blue bird. Red bird, blue bird.
And you'll actually want to oscillate in a lot of the same areas that you palpated.
Red bird, blue bird. 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 Red bird.
And as you're doing this, not only are you listening to the breathing, you're listening for signs in the lungs of abnormalities, of crackling, of wheezing, of the various other conditions that you may be able to hear. You're checking to make sure their breathing rate is normal, if they don't have any kind of dyspepsia, that everything is normal. And there are certain positions to get better keys. You ask them to roll their arms in front and bend their head down so you can listen in their back better. And to get the sides in front, it's best to ask them to lift their arms, hold them up so you have easier access and the lungs are unrestricted. And the key thing too is, this is very important, you want to make absolute sure that they are not having to use accessory muscles for breathing, that they're able to breathe fine on their own. And that's pretty much it, I think.